Dr. Azika Fayaz is a consultant pediatric radiologist at Norfolk and Norwich University Hospital and Radiology Training Program, director at the East of England Imaging Academy. So just a few ground rules before we start. The attendees can share their questions regarding technical support in the chat box. Attendees who wish to ask questions regarding the presented content are requested to leave their questions in the dedicated Q&A box after 20 minutes of the start of the talk. CME and certification related queries can be addressed at the following email address, which is asim.raza@aku.edu. Maximum possible questions will be entertained at the end of the session as time allows. And during the webinar, the same participant link can be used to rejoin the webinar in case of connectivity issues. And without further ado, I would request Dr. Azika to please start her session.
Assalamu alaikum, everyone. My name is Dr. Azika Fayaz, and I am a pediatric radiologist at the Norfolk and Norwich Hospital, as Bina has kindly introduced me. And I'm going to be talking about the different career pathways that you can have in radiology, especially if you're interested in coming to the UK. So my first question to all of you who is attending is, would you consider a career in pediatric radiology? And our moderators will share the question shortly in the poll. So if you can all please answer the questions. You'll have about 30 seconds to answer it. Okay, that's really good. So it just gives me an idea of how many people who are attending today are actually interested in pediatrics. So we have about 38% of people who are sure that they're interested, whereas 59% are those who are not so sure. So that's good. That gives us an idea. And hopefully by the end of this session, I'm hoping that the numbers will change in the favor of the yes category. So that's the aim, hopefully. So the biggest question is, why should anyone choose pediatrics? And I think for me, the main thing is I chose pediatrics out of my personal interest. And for me, the biggest thing has been that whatever subspecialty I choose, I will be doing it for the rest of my life. So I need to be happy with what I do, and I need to love what I do. And that has been the main reason of choosing pediatrics, because I felt out of all of the subspecialties that I did during my training, this was the bit that I felt the most happy with, or the most excited with. So that's why I chose pediatrics. So I think most of us, when we are during our training or during our residency, a lot of people, they kind of know what they want to do. So they are generally in the fast lane. They get through their exams in the first go. They know what they want to do in their life, and they're happy. There are some in the slow lane which take their time to kind of get through the training program, or they take their time passing their exams, but they still get there in the end. But there is a large group of people who are kind of like in the general bewilderment lane. And I guess the poll from today also kind of like suggested that there are a lot of people who are sort of like contemplating different kind of things, but not so sure about what they want to do or where they want to end up. So sessions like these, which help with the career guidance, are extremely beneficial because they help people to decide what they want to do or how they want to proceed. So I just wanted to share with all of you a little bit about my personal journey, because I think that's really important for people to understand where where I'm coming from and what I'm talking about, just so that you can relate to it, and also to kind of tell you that nothing is impossible. You can do whatever if you reach for the skies, and if you want to do what you achieve, you can achieve it. So I basically started my medical career from Quetta. So I graduated in medicine from Bolan Medical College, and after finishing my house job in Bolan Medical Hospital, I came to Karachi and I did my training at the Aga Khan University Hospital. So for 5 years, I completed my training, and at the end of the training, I then got a fellowship opportunity at the Royal Manchester Children's Hospital. And that was through a scheme that the RCR had initially started at that time, which was called the Medical Training Initiative. So via that scheme, which is also called the MTI, I got the fellowship at the Manchester Children's Hospital. And when I completed my fellowship, there were multiple job opportunities that were available. I had also received an offer to join the Manchester Children's Hospital as a consultant, but also I got another job, which was at the Norfolk and Norwich Hospital. So I aimed to join this hospital, which was back in 2017. That was my first consultant job, and I've been there since 2017. Between this time, I went through the Caesar pathway and did the Caesar workup as well, and all of that kind of helped me to get the consultant job, and I'm going to talk about it a little bit more. And then in the last 2 years, I was then appointed as the training program director for the East of England Imaging Academy, and I am currently looking after about 75 plus radiology trainees in the region, which I am in the training capacity. So it's really important in terms of if anyone has any queries regarding training, I'm happy to answer those at the end. So this is a little bit about the East of England Imaging Academy. It is one of the 3 academies in the England, and they have a bit of a different structure for training, because the training is based at the academy and also at the hospital-based training. And if we have time at the end, we can talk a bit more about that. So in terms of my personal story, I feel like what helped me get through the career pathway and through my training, I think one of the biggest thing that I can say which helped me survive in the UK and work in the UK was my training at the AKUH, because the training in AKU is excellent, and it helps you to be prepared in all of the different ways that you can work in anywhere in the country, which I think is a testament with all of the different AKU alumni joining in these talks and talking about their subspecialty. Also, my fellowship at the Royal Manchester Children's Hospital kind of helped me a lot to develop my pediatric radiology skills, and my career kind of progressed from that. But on top of that, I think the biggest thing for any person is just resilience, because it's not an easy pathway. So being resilient in terms of what you want to achieve, as well as having your family support you, has been the biggest thing for me. I'm really blessed to have a very supportive husband and very supportive in-laws who have supported me to achieve what I have achieved today. But on top of that, there were lots of struggles as well. Nothing comes easy in life. So the Caesar application was definitely a bigger struggle, because there was a lot of paperwork involved and stacks of paperwork, not just, it wasn't an online system back then when I did it. So it was all paper-based. So I had to collect stacks of paper from AKU and from Manchester and get them physically signed by my supervisors, which was a really big task. So I'm really thankful to my supervisors who helped me with that process and the FRCR exam, because the fees are high. You have to sit the exam while you're still working, and you have to kind of do that along with children as well for any female or even for male trainees. And there are struggles with childcare in the UK as well, because you have to leave your child for multiple for long hours for work, but that is the same in Pakistan as well, so nothing different in that. And I think a lot of us struggle with that anyways, wherever we live. So a little bit about the training in the UK for radiology. So in the UK, so once any candidate has been through medical school, they have to apply for foundation training, and the foundation training is usually for 2 years. After they're done with their foundation year, they have to apply for a specialty application, and there is an application process for that, which is a national application process. So you have to apply nationally, and if you're accepted, you then have an interview. And after the application process and the interview process, if somebody is successful, they then get appointed in radiology as trainees. The radiology training is a run-through training, so there isn't anything else you have to do. Once you start your training, you do that. It's a 5-year training, and at the end of your training, then you get your certificate of completion of training, which is called the CCT. You can then be eligible to be appointed as a consultant. A lot of people also apply for post-CCT fellowships. So after they finish their training, they then apply for fellowships. And then usually people end up working as consultants either before or after fellowship. And it just kind of like put things into perspective. Sometimes if you are going through training at a good pace, you can spend about 40 plus years working as a consultant in the NHS. So that's why it's really important, whatever you decide as a subspecialty, that you're happy doing that for the rest of your life. And kind of like very similar for Pakistani training as well. Once you've completed your training, you work as a consultant. That's majority of your working life. So the training in the UK is divided into like 2 bits. So from ST1 to ST3, which is the first 3 years of training, is called the core training. And then the last 2 years are called the subspecialty training. So in the core training, the trainees go through 9 modules. And this, if you look at this, it's kind of very similar to how our training at AKUH was structured. It was not module-based, but we kind of practically spent most of the time doing different subspecialty bits in training. And then the last 2 years, you spend working in the subspecialty of your choice. So if it was pediatric radiology, you'll be spending most of your last 2 years doing that, in addition to general work. So it's a 60-40 split. So 60% in your subspecialty and 40% in general work, which will include on-calls and acute CT reporting and inpatient ultrasounds and all of that. So this is the second question. Just wanted to check with all of you if people are aware of what career pathways are actually available. What career pathways are you aware of that are available? So second question is a short answer or free text question, so you can write anything that you're aware of that would work or you're aware of. There's been 15 responses. If the moderators can kindly show us if there have been any Can the moderators please share if there were any responses from the question, the poll question? Okay, I think I'll come back to it once we've been through it. So just to kind of share with you what different career pathways that I'm aware of. There might be more, but these are the ones that I'm aware of. So all of us know about the FRCR. So in order to work in the UK, you need to have your FRCR exam completed. And if you are training in Pakistan, then there are lots of opportunities for you to sit the exam. Pakistan is also now an exam center for the FRCR examination, so that's not so much of a problem in terms of traveling outside. Then comes the CSER pathway. So the CSER pathway is the Certificate of Eligibility for Specialty Register. It's also called the portfolio pathway. I'll talk about it a bit. Then we have the MTI fellowship, which is the Medical Training Initiative fellowships. And then you have the SAS, or the locally employed doctors, or the specialty grade jobs. ST3 recruitment is something that the RCR has recently introduced. I'll talk a bit about that, and then consultant job and something about the GMC guidance. So we'll talk through these things. So to begin with, the MTI is a medical training initiative. It's still running with the RCR. And this scheme is designed to allow a limited number of overseas doctors to enter the UK for a maximum of 2 years to benefit from training and to develop and development in the NHS. So this is the main theme of that, and this is the link that you can search for this, or if you just Google search MTI initiative and it will come up. Then the other pathway that we talked about is the GMC CSER pathway, which is also called the portfolio pathway. And that requires quite an extensive bit of workload for paperwork. And also it's really helpful if you're interested in this pathway that you check the up-to-date guidance on the GMC website. So for the portfolio pathway, the main thing is that you need to have completed 5 years of training in radiology, and you need to have your FRCR. It gives you much more possibility in passing your application if you have passed the FRCR. You can still apply for the CSER pathway if you have not passed the FRCR, but the chances of getting a good outcome will be dependent on how strong the rest of your portfolio is. So one of the biggest benefit of training while you're still training is that if you are interested in doing the CSER pathway, everything is now online. The application process is online. You can upload your documents online, so there's no paper trail involved, but you need to collect that evidence. So if you are interested in this, my advice would be to look at the GMC website and look at what evidence will be required. I will talk a little bit about what is required. But if you start collecting the evidence as you are training, that will definitely help you to work towards the CSER application and your life become a little bit easy. So the portfolio that I was talking about, it talks about capabilities in practice, or what we call in the short form is SIPs. So there are 12 SIPs in total, which include the generic and specialty specific SIPs. And this is something that the RCR has recently introduced last year. And the portfolio pathway also talks about these SIPs. So these are the same SIPs that the radiology trainees are evaluated against in the UK. So when the trainees are going through their training, at the end of every year, there is an ARCP, which is called the Annual Review of the Competencies and Practice. So in that ARCP process, each trainee is evaluated against their capabilities in practice, or SIPs. And you need 5 years of evidence. So this is what the SIPs look like. So if you can find it on the RCR website, or I've shared the links with the moderators. You can access it via the link. So if I talk about this, this is what the training in the UK looks like. So you need to have 5 years of training. Then there are progression points, and you need to have passed your exams by the time you finish your 5 years of training. You have to have passed your exams. And if you look at this, there are mini IPXs, which is assessment of the reporting skills, which can be CT scans, MRs, so anything that is reporting based. And the direct observation of procedural skills is called DOPS. So you need to have, this is the number of DOPS. So the minimum number of DOPS you require as an ST1 is 6. And then each year is about 6. That's the minimum amount. MSF is multi-source feedback or 360-degree evaluation. You need 2 teaching observations each year. Quality improvement projects or audits, 1 each year. And then MDT assessments are optional initially, but then in the later years, you need to have at least 2. So these are the minimum requirements. And while you're training, if you start collecting data of all these things for each year, that's definitely going to help you. So I'm not sure if different training schemes in Pakistan have availability for assessment or acquisition of these data. But if you do have any paperwork that you can get signed by your supervisors, then that definitely helps. These are the SIPs that I was talking about. So there are about 6 generic SIPs and 12 specialty-specific SIPs. And if you look at this, there are different numbers given here, which is 1, 2, 3, 4. So 1 stands for just observation only. 2 is with a direct supervision. 3 is with indirect supervision, and 4 is independent, or you're already kind of like independent in doing this. So if you look at the first SIP, which is professionalism and behaviors expected of all doctors, and all trainees are expected to demonstrate professionalism throughout their training, and there's no compromise on that. But by the time you reach an ST5, you can see that all these SIPs are graded at level 4, so you have to be independent. And that is something similar of a standard that will be checked by the GMC if you are applying for a portfolio pathway. And if you look at the GMC guidance, you will see that all the portfolio evidence that is required will be divided into these SIPs or different domains. And then these are procedural skills again. You can see that these are graded as 1, 2, 3, 4. And there are certain skills that they don't require you to have to be independent in, like wire-guided procedures or catheter manipulation, because the general radiology trainees do not perform interventional radiology skills. So this is for general radiology training. But if somebody is interested in doing IR, then IR is a separate assessment, and they have different pathway assessment tools for them. The other recruitment opportunity that the RCR provides is with what is called the ST3 recruitment. And this is, again, something that has been recently introduced. What that does is that in order to apply for an ST3 training post in the UK, you can still do that even if you're outside the UK. So if you have a training post and you're an overseas doctor, even without full GMC registration, you can apply to this ST3 recruitment. It still requires paperwork, so nothing is free of paperwork, but you need to do that paperwork, which is called, it's a certificate which you will have to fill out, which is a Word document. And you have to get that signed by your supervisor. And once all of that is signed, you can then apply for an ST3 recruitment job. And you need to have completed your first 2 years. You need to be kind of like at the same level of as any UK-based trainee who's done first 2 years of training, and you should have passed your Part 1 FRCR exam. And there's a bit of paperwork that's required. The downside with this is that there won't be a lot of ST3 recruitment opportunities available in the UK, but you'll have to find those yourself, or you'll have to wait for the window of opportunity, or when the interviews open, or when the application process opens. So you'll have to keep an eye on that. And there is, this is the certificate, alternative certificate to enter clinical radiology specialty training at ST3. So this is a Word document that is available on the GMC website. I've included the links for that. Send them to the moderator, so they'll be sharing it with you later. And the Word document is available on that. So if you look at the Word document, it will show you, give you an idea of what is required to fill this certificate. So the applicant should have an MBBS or equivalent, Part 1 by the application date. They should be eligible for full registration. It doesn't mean that you need to have full registration. So you can, you're eligible for full registration, and also you need to have evidence which is going to be provided by the Word document I was talking about of your ST2 capabilities via this alternative certificate to enter radiology and to be eligible to work in the UK. So this is another pathway that you can take for coming to the UK. Then apart from that, you might be aware of a lot of specialty grade jobs. So these are non-training posts. A lot of hospitals, especially smaller hospitals, which don't have a lot of in terms of workforce, they often struggle to recruit people, and a lot of specialty grade jobs are available in those hospitals, which are usually called the DGH hospitals or district general hospitals. So these are kind of like smaller setup hospitals, and a lot of time they have jobs available for specialty grade. They will require the candidates to be almost independent in working, but it's a non-training post. So there are very few chances of career progression. And a lot of times people, if they are on specialty grade jobs, they tend to find that after a few years, they find that their career is not progressing anywhere. So that is something to be aware of if you are applying for it. But if you are kind of like within the setup, there are definitely opportunities to progress your career if you want to kind of go through that. Then consultant jobs, locum and substantive. Consultant jobs are available in the UK. The substantive jobs are for those candidates who have passed their FRCR or who have got their CCT after radiology training in the UK, or they have got a CSER if they did not train in the UK. But if you don't have any of those things, then sometimes NHS trusts may have ability to hire people as locum consultants, even without having completed everything. But that is very dependent on the trust and depends on what they want, what kind of skill set you are coming to them, and what they have on offer. So it's very variable. So the thing is, how does one decide in terms of what they want to do, whether they want to come to the UK, whether they want to pursue pediatric radiology or not? There is no right answer for that. Sometimes something just clicks for certain people, and some people just know that this is what they want to do. Sometimes they have family commitments. So if people get married, they have in-laws in the UK and they want to move, then kind of like you want to do it because of that. Sometimes people have really good experiences of working with amazing people that influence them, inspire them to take on pediatric radiology, which was definitely something that happened for me. And personal interest and also work-life balance in terms of what really works for you as a person. So what clicked for me, obviously, excellent role models in AKUH, and definitely I can say Dr. Yusuf, may he rest in peace. He was an amazing role model for me, as well as Dr. Naila, Dr. Wasim. They were all working in pediatrics when I trained, and they definitely inspired me to take it on. And also I had amazing role models in Manchester, where I worked and did my fellowship and that kind of really helped to shape me who I was. What I love about radiology is the varied dynamic. So every day you get to see amazing things, lots of pathology and lots of different cases. So you could be like reporting an MRI of the head, and the other, after a few hours, you might be doing an upper GI contrast study on a child, or reporting x-rays for fractures, or doing a small bowel ultrasound. So there's so many choice of everything and anything you may wish to do. Whereas I found that for a lot of other specialties, sometimes work can become a bit monotonous. But in pediatrics, there's always something or the other amazing that's happening. So in the UK, what does the role of pediatric radiology look like? So there's lots of different things. It depends on where you're working. So where I'm working is a big tertiary care hospital where there's a big pediatric surgical department, and they because of that, we have a separate pediatric radiology on call. So if in the middle of the night a child needs an upper GI contrast study or they need an intussusception reduction, then I have to go in, whether it's 2 in the morning, and do that procedure. But that's like the on-call, and the on-call frequency is a little bit higher compared to general on-call frequency. We also have to do safeguarding work for non-accidental injuries if there are concerns regarding child abuse. And sometimes you may have to go to the court and provide a witness, but it's not always that happens, because the court system has an expert witnesses that they certain really expert radiologists who work for them, so you don't always have to go to the court. And also in pediatrics, you have scope for developing your niche interests, so congenital cardiac diseases or fetal imaging or postmortem imaging. So there's lots of different amazing things that you can do in pediatrics if you have an interest in them. Some people choose radiology in pediatrics because there is generally a shortage of radiologists, and especially pediatric radiologists in the UK. So if you want to do pediatrics, the chances of getting a job are much higher. There are flexible working hours, so NHS has got very good opportunities of having flexible working hours. If you want to work 3 days in a week or 4 days in a week or 5 days in a week, you can choose what kind of work you want to do. Working from home is also possible, but there will always be a hybrid work model. So one day maybe you're working from home, the other days you might be working from your hospital. There are some opportunities for teleradiology and private practice, but in pediatrics, it's not that lucrative. It's more general work that people do for this. So if you are interested in coming to the UK, then keep an eye out on the NHS Jobs and BMJ Careers website. That is where you'll find the adverts for jobs. There are about 31 children's hospitals in the UK, which are the big tertiary centres, but there are many district general hospitals where there's always opportunities for doing general work mixed with pediatric work, if that is something that interests you. And further subspecialties in pediatrics are also available. So people do neuroradiology or body imaging or pediatric MSK or interventional radiology in pediatrics, but these then become further niche practices of work. But if people are interested, they can choose to further subspecialize. There are big hospitals which do provide pediatric radiology fellowships in the UK, if that is something you're interested in. But the thing is that a lot of these places will have their fellowships available for their local candidates before they open it to international candidates. So there are certain hurdles to that, but you have to kind of keep an eye out or find those places by yourself. So that's the bit of hard work that you have to do in the background and approach those centers directly. So currently in Pakistan, there are no pediatric radiology fellowships, and I'm really excited to hear that maybe there's something in the pipeline in the AQUH which might be opening up for a fellowship in Pakistan, which will be the first ever one. And if you do want to come to the UK or progress your career in pediatrics, then look at these pediatric societies. What I would suggest is attend any of the pediatric conferences, which is really amazing for networking and learning. And also you should be aiming to present some abstracts or posters, attend some conferences, or do some audits which are pediatric based. And these are all things that are very important for your developing your portfolio for CSER and also for your career development in pediatrics. So my take-home message will be, do your research, find what you want to do, and you'll have to keep an eye out for all of those different websites I told you about. So keep up to date with the recent guidance and information, pass your FRCR, and work towards building your portfolio in terms of all those things that you will require for a CSER. And there are financial implications for all these things. Everything is very costly, especially with the current climate where everything is quite expensive. So you have to find your own unique pathway, but you do require lots of hard work and resilience to get there. So can I just ask a free text for anyone who would like to put the answer in the chat box? What is the answer? Because we can't ever have a radiology talk without showing an X-ray, isn't it? So I'll just give a minute for anyone who would want to talk about or give the diagnosis in terms of what is the answer for this question, for this chest X-ray. Moderators, are you seeing any responses? Because I can't see anything on my side.
Dr. Zika, I think we have a few coming in.
Okay.
Yeah,
yes,
because before that, our chat was disabled.
Okay.
We just enabled our chat.
Yes, so excellent. Lots of correct answers coming up. So yes, it is a misplaced ETT that is in the esophagus, and you can see that the trachea is separately visualized and the lungs are completely white out. So no wonder the child is not breathing properly. But excellent, well done for everyone who gave the correct answer. So after hearing my talk, would you still consider a career in pediatric radiology? So the moderators will open the poll again for you. You will have about 30 seconds to answer that. Yeah. So there is definitely an improvement in the yes category, but there's still lots of people. About 50% are still in the maybe zone, which is fine, and kind of totally expected. So that's good. And that's it from me. Thank you very much for listening. That's my email address. If you want to email me or ask anything more, I'm happy to answer your questions. Thank you.
Thank you so much, Dr. Zika. We would now request Dr. Salman to begin his talk.
Thank you, Mina, for the fun introduction. Let me share my screen. All right, can you see my screen right now?
Yes, Dr. Salman, we can.
Okay. All right, great. So I'm Salman. I'm going to be talking about the career pathways in pediatric radiology in US. I mean, basically, there are two pathways to work as a pediatric radiology in US. The one is the conventional pathway, which is basically designed for the local for the US graduates. So they just after the med school they go into the intern years, which is just 1 year, and then they go into the diagnostic radiology residency, which is 4 years, and then after finishing the diagnostic radiology, they do 1 year of pediatric radiology. So I mean, most of the pediatric hospitals, they have a general pediatric fellowship, which is mainly a body fellowship, like you do chest and abdomen and pelvis, and then they have subspecialty pediatric radiology fellowship as well, like you go to MSK, you do neuroradiology, oncology, and like a lot of other fellowship as well. But the main one is the general pediatric radiology, which is basically the body radiologist. And then the other pathway is the ABR alternate pathway, which is basically designed for the IMGs or the International Medical Graduate. So this requires 4 years of training in the US, and it should be at the one institution. So you can do as 1 year of pediatric radiology, and then you can work as 3 years of attending. So it can be a combination of any fellowship or residency and attending, but it should be done at one institution. And then the program or the hospital must have a residency program in it as well. And then there is some eligibility criteria before applying to the ABR pathway. The most important one is to take the license exam. The MLE that's the first thing you need to do if you want to apply for the alternate pathway. The other thing is you must have done 4 years of diagnostic radiology training in the home country, and then you can apply for the fellowships in the US. So then you can do a 1 year of radiology fellowship. It can be either a combination of pediatric radiology, body imaging, neuroimaging, whatever you like. You need to do 4 years in a single institution. You can either do 1 year of fellowship, and then you can do the remaining year as attending, depending on your on the hospital where they have a vacancy in the radiology department, and they can hire you as a radiologist. And then working for 3 years, either as a fellowship or as a radiologist, you need to take the core exam, and then at the end of the 4 year, you need to take the certifying exam, which will make you eligible for the ABR certification. So once you're done with the ABR certification, then you are free to work as an independent pediatric radiologist or as any radiologist. So the application process for the pediatric radiology fellowship is basically you need to complete 4 years of diagnostic radiology residency. And then you need to submit your CV, the personal statement, why you are interested in, if you're doing pediatric radiology, then you need to tell about them why you're doing pediatric radiology. You need at least 3 letters of recommendation, 1 from the program director, and then 2 from the pediatric radiologist. And obviously, MLEs it's a license exam, so you can't work without taking USMLE. And then if you are interested in coming to US for a fellowship or as a working attending, you need to start the process at least a year or 2 years before. So when I was applying, they don't need the FCPS pass exam, but they just added it in the eligibility criteria that you need to pass the FCPS. When I applied in 2020, it was just the 4 years of training. You don't need any FCPS exam, but they just added it to their eligibility criteria that you must have the FCPS exam now before applying to for the fellowships. So the other most important thing is the visa. Most of the hospitals, they're going to sponsor either a J1 or H1. That's the 2 visas they're going to sponsor. I would love to get H1B. That's what I am on. It's give you a freedom. You can do moonlighting in the same hospital. On the J1 is going to be just the training program. So you will just do your training. You can't do anything other than that. And after finishing the training, you need to go to the periphery, like some small community programs where you need to work for at least 3 years, and then you can work anywhere in the US. But on the H1, you can do you can work anywhere in the US from the first day of your work. You can do moonlighting in your hospital. Moonlighting is, you can just work extra shifts, and then they pay for that shifts, even as a fellow as well. So if you are an H1B, you can work as on the weekends and get paid for that. The other thing about that is H1 is good is that, you can apply for the green cards right from the start. So when you start working on H1B, You can apply for your green card. Sometimes the hospital will sponsor your green card as well, and you can become a permanent resident. So most of the hospitals, they usually prefer J1 because it's easy to get that. H1 is a cap program. So there are like 70,000 program where they can apply for H1. That's the maximum capacity. So there are other people like IT and everyone. So everybody is looking for H1B, but there are few H1B which is specific for the medical field. If you get a chance, always go for H1B rather than J1. These are some pediatric radiology fellowship programs which offer pediatric radiology fellowship. I did mine in the University of Tennessee Health Science Center, which is in Memphis, and I did just 1 year of fellowship there. I did in body imaging, and then I moved to University of Texas here in Houston, where I'm working as assistant professor for the last 3 years now. But there are other notable pediatric radiology fellowship like Cincinnati Children's Hospital. Texas Children's Hospital is just next to our hospital. It's one of the largest one. It's almost like 1,800 bed hospital, and they have multiple fellowships in Texas Children's Hospital all the time available. You can also go to the Boston. They're all the time they are looking for pediatric radiology fellowship applicants. But at least apply one year or maybe 2 years better to these hospital fellowship. You guys can just do 1 year of fellowship and then go back to Pakistan if you want to do that. But if you want to stay in the US, you need to do at least 4 years of commitment to the same hospital, what could be in the form of a fellowship or residency or attending, but it should be 4 years in the same hospital. Some subspecialty training which are offered in these hospitals are the neuroradiology, interventional radiology. I did my in body imaging, which is just a general pediatric radiology. So I don't read any neuro, any cardiac imaging. We have a MSK pediatric radiology, so they are reading that, but we usually do the body imaging and oncology imaging here. So this is just the responsibility or life as a pediatric radiology fellow in the US. So your clinical responsibility will be imaging, interpretation of the imaging, which is going to be the main one, and then protocols, CT and MRI, performing procedures, and then doing the multidisciplinary team meetings. That's going to be the clinical responsibility. And then the work-life balance is really good. As a pediatric radiologist, you just work as the 8 to 5 most of the time. You just need to do night shift. I think just 6 or 7 the whole year. So most of the residents, they are covering the night shift, but as a pediatric radiology fellow, you still need to do, I think, 6 or 7 nights, would start from 8 p.m. to 8 a.m. in the morning. And then one of the attending is also covering with you. So you just start reading around 8 p.m. and then you finish your call around 8 a.m. in the next morning, and then you are off for a couple of days as well. So so the work-life balance is good. You usually get free by 5. You get all the weekends off, Saturday and Sunday both off. So you have ample time to go around, to study, whatever you do. If you have family, you can go outside. So, and then you get like almost 25 days of paid leaves as well. So, so very good time for as a fellow in pediatric radiology. And once you're done with your fellowship, you can go to either a pediatric into academic program or the private. So academic program is basically where a teaching hospital where you have a resident or medical students where you need to teach them. You need to do some research as well. Private practice is, just doing clinical work without any responsibility of teaching to the medical students or the residents. And then you can also work as with some vendors like GE or whatever, if you want to go into that as a as the imaging technology thing. So this is the reference. I mean, you guys can go to the ABR website. They have mentioned the same thing about the ABR pathways for the IMGs, which is basically just doing 4 years of training, which can be done as a fellowship, as attending, or combination of fellowship and attending. So I just did 1 year of fellowship and 4 years of attending. So now I'm almost done with my pathway. I'll be finished by this June. So it should be done at the one hospital. That's the main requirement for those. And it can be done in either as a fellowship or as attending. The first thing is you need to do the USMLE, so that's the main step. And if you plan to come to US, you should start reading at least. I mean, the USMLE is going to take at least 1 year. Since you don't need any score now, particularly for the step 1, and if you are applying for the fellowship, the score you want doesn't matter for the fellowship as well on step 2. We don't have now CS, that's a good thing, and then you need to do step 3 to get the H-1B visa. So if you are just coming for 1 year, you don't need to do the step 3. But if you are coming here as a pediatric, I want to work in the US for a long time, you need to take the step 3 as well. And then because it will, for the state license, you need step 3 as if you're working as an independent radiologist. So you need to pass step 3 as well for that. But if you just want to work here as a pediatric radiology fellow for 1 year, you can just do it with step 1, step 2, and I think it's OET rather than the step CS, step 2 CKCS. So that's it from my side. So just to recap, I mean, to work here in the US, you need to do USMLE. I would prefer doing step 3 before applying to that, because it will open the H-1B category for you. Then you need to find a hospital which can sponsor you for 4 years. That's the most important part, because if you move from one hospital to the hospital, the pathway start from the start. You need to start over again from your first year. So you need to stay in the same hospital for 4 years. Most of the hospital, they will see you verbally, because the contract system here is year by year, so they can't give you a 4-year contract at the start, but they will tell you that they're going to keep you for 4 years. Yeah, so that's I think that's all about I mean the working in the I mean all the opportunities in the US. You need to do USMLE first and then apply wardly. I mean, I would recommend applying to as many as program you can, and then you have option to choose one of them. So that's going to be my advice. All right, thank you.
So thank you so much, Dr. Salman and Dr. Zika, for such a wonderful review of the career pathways. Mostly we as Pakistani residents and candidates are quite naive to these opportunities, and sometimes we just, due to lack of our information, miss these. So just for a brief recap, coming firstly to you, Dr. Salman, can you give a brief review of the licensing pathway that you used for your career in the US after completion of your residency in Pakistan? And was there any selective advantage of the AKU residency that you faced while you merged into this setup abroad?
I mean, the AQ residency is one of the best residency. I did my electives in US as well. So when I was a 4th-year resident in AQ, so I went there before going to RSNA. I went to one of the University of Virginia. I did my fellowship. I mean, my electives there. Our residency program in Al Khan is such a structured program. I mean, it helped you so much. So I went there. And when I did my 4 week electives at the end of, because I was thinking of moving to the US from the start. So I went to the program director. I talked to him that I need to, I'm planning of coming here to US for and work here as a radiologist. He gave me a very good letter of recommendation. He said, I talked to him about our program, residency program. He was so happy with us. He gave me a very good letter of recommendation. He also said, that's the one he told me about the alternate pathway. He said, I can give you a residency spot as well, but you need to do like the intern years and everything is going to take you 5 years. And then you need to do a fellowship as well. So it's going to be 6 years. Why don't you do just 1 year or 2 year of fellowship and then work as attending? You don't need more training. You are done. You guys are so good. So I used to go to their conference. He was super happy about that. So, the AQ residency is so good. And then particularly, the pediatric, that's the only program in Pakistan where you have like the specific pediatric rotation as a resident. We used to get as a R2, R3, and R4, like 3 months of specific pediatric radiology. And it's so good. Even in US, when the resident, the medical student come to us, we usually do like a body imaging. But in AQ, we have neuro. We used to go hands-on ultrasound. Here, the ultrasound tech used to do the ultrasound for you, and then you just read the images. But in Pakistan, you go back, you do all those hip ultrasound, spine ultrasound. It's so good. Do fluoro by yourself. And the other thing I like about AQ residency is the so many tumor boards. Dr. Kiran was the one I still remember. I was a chief resident, and she introduced all those lymphoma tumor, orbital tumors, and you learn so much from those tumor boards, multidisciplinary meetings. They discuss, what the clinician wants from you, rather than, doing all the reporting. You also specific mention what they want to see in all those cases. So, I like so much about the AQ residency program. I'm so grateful. I learned so much from there. I don't have any problem when I was here. I had people from other countries as well, and they was like, they don't have the structure residency program over there, and they had a difficulty when they started. But I was so good when I moved here. It was pretty good. So I love. AQ residency is so good. It's so structured, so very good. About the licensing, there are 50 states in US, and every state has their own criteria. So some of the state, they ask you to do 1 year of 1 year, 2 year, or 3 years. That's the max. The 3 is the maximum where you need to do a training. So in my case, because I did just 1 year of training and then I moved work as attending, so my program or my hospital write to them that we need we need someone as a faculty. So there is a thing which is called temporary license, and you can just work on that in the same hospital. So there are always ways. They can work for you. I did just 1 year of fellowship, and then I started working as attending, and then last year I got the permanent license as well. So you just need to work. It's dependent on the state. So I'm in Texas. So Texas asks you to do 2 years of training. So I did 1 year of training, and then they count my first year as attending as a training, and then they gave me the license as well. So yeah, the only thing the other thing which need to be is you can't do locums here on the visas, even though you are on H1 or J1, you can't do locums. The only thing is you can do moonlighting if you are on H1. Moonlighting is the same thing as a locum, but it's going to be in the same hospital because the visa is just specific for one institution or one hospital. So you can't do anything other than your own hospital unless you get your permanent green card.
Right. Thank you so much for that. So, Dr. Zika, the same question to you. What was the specific licensing pathway that you used, and how were you at a selective advantage after your residency at AKUH?
So, what pathway I used? So, as Dr. Salman has said that he did an elective in the US. So, I planned to go to the UK because I got married and my in-laws were living in the UK. So I knew that I had to do all the things that I need to do. So I did 1 month of elective in Great Ormond Street. So that was the elective month that we were all able to do as 4th years or 5th years of trainees. So you may already know, as part of the AKU training program, we got 1 month of elective. A lot of people do it locally, but you can go internationally if you want to. So I did that, and that definitely helped me to see how things are done in the NHS, how people work here, what is the work culture, and what other pathways are available there. And at that time, there was no options for MTIs with the RCR. So then I applied for the MTI when they opened it up. And the thing is, you have to find your own space. So you have to continuously email different places if they have any spaces available. So that is the background hard work you have to do for your own work. So I had to email multiple places to find if they have a place for a pediatric radiology fellowship. And at that time, Manchester was the place that had the space, and they interviewed me, and I got the fellowship. And I went as an MTI fellow, spent 1.5 years there. And in that meantime, I had completed my FRCR exam as well, and also was working on my Caesar application. And once all of that was complete, I got a consultant job offer, and then I kind of worked as a consultant. So I didn't have to do any PLAB exams. I didn't have to do any other exams, because PLAB in the UK is mainly for those candidates who have freshly done their MBBS. And if you want to apply for a training job in the UK, then you need to sit the PLAB exam. If you're already training in the UK, in Pakistan, then you don't have to focus your time and energy working on the PLAB exam if you're not interested in applying for training program in the UK. So that's the only kind of difference. So if you're applying for an ST3 job, or if you're applying for a Caesar route, you don't need the PLAB exam. But if you want to come to the UK to work as a trainee or apply for the training program, that is the only time where you need a PLAB exam. So that's the difference between the American bits and the UK bit. And definitely AKU residency was the I would say that's the building block that helped me to start my career as a radiologist. And as we've already talked about, we have different rotations in there. It's a very structured program. Everything has got documented paperwork. We do lots of MDT work. Then we did lots of internal examinations in addition to the external exams. You get prepared to do lots of presentations on a weekly basis, and you are encouraged, or rather I would say you're mainly pushed to submit things into the different conferences, be it local or national or international. Your people are always pushing you. You have to do it. You're there. There isn't really a choice. So I think that kind of really helps you shape up for your future. And I think at that time, when you are a trainee or a resident, you just feel like, what have I done to deserve this? But after a few years, you just definitely reap the benefit and reap the fruits of the hard work that you put in. And I think the on-call work in AKU also helps to shape up and give you the confidence for working in here. So I think our on-calls are so frequent and so difficult that, when you come to the UK, you find that, is this all that they want me to do? Are you sure there's nothing missing here? So I think the work-life balance in the UK is much different to the work-life balance we have in Pakistan, and the workload that you have is quite different, and the way of doing things is quite different. But it's definitely worth all the hard work that you have to put in, the paperwork you have to put in, the exams. It's definitely worth it if that's something that you want to aspire to do.
Thank you so much, Dr. Zika. A question that I would address to both of you, and this would be, what would be the ideal time to appear for either the FRCR or the STEPS during the residency program, and how much time should residents spend preparing for these exams?
So for USMLE, it's going to be at least 6 months for the step one. When you're done with the step one, the step two is a little bit easier. So you get most of the clinical stuff. You are already, aware of the clinical stuff. The step one is just the basic science. So, you need to go back to all those pharmacology, microbiology. It's just a little bit painful process, but you need to do that one. So it's going to take at least 6 months. And once you're done with the step one, then it's going to be step two, which is a little bit clinical. It's more clinical thing. So it's not. It's going to take you maybe 3 or 4 months. Since the good thing about that is that you don't need to get high score. You just need to pass it. The step one is now even though pass fail, but for the step two, you don't need to get like 250s or crazy high marks. Until unless you want to go to radiology residency. The radiology residency in US is high. It's very competitive. It's one of the top 3 residency you need to match in those ones. So it's most of the US graduate would go into that because the work-life balance is so good. And after COVID, it's even more competitive. You even can't think of IMG doing a couple of research here, and then you can apply for the residency match. So but I would maximum give 1 year to all those steps, step 1, 2, and then since we don't have steps, the CS now is just the OET. So within 1 year I should be ready for applying to the fellowship at least. And then the fellowship usually take like a couple of years because they usually fill the position at least 1 year before the start of the fellowship. So if you are applying for 2026, you should start applying right now, which is going to be a good time.
Oh, okay, thank you, Dr. Salman. And the same question for Dr. Zika.
I think from timing wise, if you're planning to sit the FRCR exam, I would suggest because the basic curriculum is the same. But while you're preparing for your FCPS exams, you should start preparing and studying the same way for the FRCR exam. And that is what a lot of people who plan to sit the FRCR do. So you have to do the physics and anatomy for the part 1 exam, which you need to do for the intermediate module anyways. And also for the second part, you need to do all the basic kind of theory as well as practical for that. So I would suggest if anyone is interested to start working towards the FRCR exam while you're preparing for the FCPS at the same time, because the curriculum is the same. The way of the examination is different. And on top of that, you have to factor in the cost of actually sitting the exam, the fees that applies to all of these exams, plus if you're sitting the FCPS at the same time, and if you are able to do kind of like both at the same time, then it's up to you really. And sorry, what was your other question? Electives?
No, just how much time should one spend preparing?
How much time? I think it's very variable depending on every person's personalities and way of studying, and your personal circumstances are different. So I think for each attempt of the exam, you should have at least 6 months time dedicated for each attempt. So if it's FRCR, for each part of the exam, at least 6 months each. What would I suggest would be the minimum?
Okay, all right. So another question that has been frequently coming up to us is that if we have not cleared our FCPS after our residency in Pakistan, so if we want to pursue a postgraduate certification either in the UK or in the US, so how can we proceed for that? Whether is it a necessity to go for the clearance of FCPS, or we can just go smoothly without clearing our FCPS after our training in Pakistan?
So if you are thinking about going for the Caesar pathway, then having a local examination passed definitely puts you in a better position. You can still apply for the Caesar pathway, but you will have to provide a lot more evidence and also to say why you were not able to pass your local exams. So you have to have passed the FRCR or an equivalent exam to apply for the Caesar. So for the Caesar, if you have passed the exam, that puts you in a better position. But there is no requirement for you to have passed any exams to apply for the CSER. You can apply for it. Similarly, for the ST3 recruitment, you don't have to have passed any of FCPS exams. You need to have passed the part 1 of the FRCR to apply for the ST3 recruitment. So you have to have passed some kind of an examination, which puts you in a better position. Some people struggle with exams for no fault of their own. And if you're struggling with FCPS, maybe apply for FRCR. You might have better chances of passing that because the examination is much more uniform, and the way of conducting the exam is much more structured. So some people find that beneficial.
Right. So same question, Dr. Salman, that whether clearing FCPS puts you at an advantage, or is it just smooth ride without clearing your FCPS?
I mean, they just recently added the requirement of passing the FCPS for the ABR certification, but you can still work as a fellow, or you can just work in the same hospital without even passing the FCPS. But you need the 4 years diagnostic residency certificate from your hospital. But if you want to sit in the exams, then you need to. You now need the requirement is that you need to pass your FCPS exam. But you can still do your fellowship without even the FCPS exam.
Okay, all right. So can we just briefly revisit any portals or any websites that we can easily access to get the latest guidelines regarding either the GMC registration or the ABR pathway that you have just discussed? If you can just briefly retouch those.
So for the ABR pathway, you need to contact the hospital, and then when you come here for a fellowship or for whatever reason, as an attending or as a resident, then the ABR sent you a contract which you need to sign, and then the chairman of the department need to sign on it that this guy gonna stay with us for 4 years. That's what the ABR wants. That's the only thing. So you can do it when you are in Pakistan or somewhere else. You need to start this process when you join as a fellow or as a attending. And then the ABR will send you a contract which you need to get signed by your departmental chair and then by yourself, and then you send it back to the ABR. So ABR is basically just like in Pakistan is just like the CPSP. This is just the governing body taking care of the boards and everything.
And what about elective opportunities, both in the US and the UK, for people who aspire to go to either of these countries for any kind of experience in radiology?
I would strongly suggest to go for electives. Our program, the AQ residency program was very supportive. We have like a 4-week slot where you can just go and do your electives. And then it helped me a lot. You go there, you check their program, you talk to the people, to the resident. They have so much information about those things. So I would strongly, if you guys have any plan, you can plan it like going to RSNA, which is one of the biggest, radiology conference. So you can always arrange, like you can go to the RSNA and then do the 4 weeks of electives as well. But it's very good. It's just opened up so much thing for you. My program director did everything for me. So, he wrote to the program. They hired me then, and he was very open. He said if you want to do residency, you can do residency with us. But it's really good. I would strongly recommend doing electives, and then for electives, you need to. I think I wrote almost like 50 to 60 programs asking for electives, and then out of those 50 to 60, only 3 programs responded. So, you need to write to so many people, and you can just do it randomly, apply to us like major university programs, and then talk to them, and then when you get the opportunity, go there. Work hard. For us, it was very. It's exactly the same thing like what we do in AKU. They have really like the same structured program. They ask the resident to start reading. They read out to the resident. They have a noon conference, just like we used to have the afternoon conference, like from 4:30 to 5:30, something like that in AQU. So it's exactly the same, but they call it a noon conference because it's at the noon time. So you can go there. So I mean, it's a very good opportunity just to see how your program is different from the US program. So I would strongly recommend doing that. I mean, in case if you're planning to come to US and doing fellowship. The other thing is that, I mean, if you don't want to do that, because I mean, it's going to be very expensive, to be honest, staying in US for 4 weeks, doing all the visa and everything. I don't know whether the AQU can accommodate some people, or maybe just for 4 weeks electives or anything. It's so good opportunity. I mean, it's just exactly working as the US. It's the same structure program. I mean, you will attend all those multidisciplinary meetings and everything, the resident teaching program, so it's a very good experience. I mean, I would strongly recommend at least doing 4 to 8 weeks of electives, whether in Pakistan or US, but I mean, it's a very good experience.
The same question to you, Dr. Zika.
So for electives in the UK, again, it's the same thing. You have to find electives for yourselves by emailing different places and different training programs and see if they can accommodate you. Radiology in the UK is also becoming very competitive. So a lot of the medical students who are in the UK, they apply for a lot of electives. So it kind of tends to become very competitive. But there are certain places who can accommodate electives, but you will have to plan them at least 6 months in advance, because in order to apply for a visa and in order to come across and find a place to live for a month and kind of do the electives, you need to have that planned well in advance. So if your training program accommodates that or fulfills that, then yes, that is definitely a really good option for you, especially if you're planning to come to the UK. But it does definitely involve a lot of cost, so you have to kind of factor that in.
Right. So there's another question that is frequently popping up in our Q&A box. That is that there are a few people who have done their FCPS and a few who have done their MCPS, while there are others who have done their EDIR. So how does that affect your opportunities in getting into the UK?
So I think for EDIR, European Diploma in Radiology, the European systems are quite different. And if you're planning to work in EU, so UK is not part of EU anymore. So the rules and regulations are quite different. So it depends on which country you're planning to go in. Each country will have their own different policies. And I'm not aware of what different policies different countries have. I'm only aware of what they have in the UK. But it is definitely possible to apply for the UK residencies, especially the ST3 recruitment. If you have done your Part 1 exam, then you can apply for that.
Right. So, Dr. Salman, same question that where the people who have done their 2 years training in Pakistan, like, can they apply for any additional training or any additional certification in the US?
No, I mean, the only requirement here is 4 years of radiology residency. So, unfortunately, the DMRD and the MCPS people, they can't apply for a fellowship.
There's a question in the chat box which says, is there a pathway for radiology residents if one is unable to clear the USMLE?
No, that's the license exam. I mean, you can't do anything without MLE. That's going to be the first thing to even think about going to US. So, I mean, you can't do anything unless the PMDC allow you to do anything, right? So, so it's just the license exam. You can't do anything without that. You need to pass MLE before going to even thinking about going to US.
Right. So, any final closing remarks or the final message that you would like to give to our future aspirants for their pursuance of their career either in the US or in the UK? So, Dr. Salman, to start off with you.
I mean, for me, if if you want to apply to US, you're going to start working on it because it's going to be a long process. You need to do USMLE, which is going to take almost like one. I mean, if you're doing it with a residency, then it's going to take even more than that, right? So you need to clear the MLEs, and then, I mean, maybe at the end of your residency, you can just do, I would just like to do electives, and particularly, I mean, going to a big conference like RSNA, or if you are more interested in the pediatric, we have the Society for Pediatric Radiology. You can go there. I mean, I would like the Society of Pediatric Radiology because it's a small community and it's just specific for the pediatric radiologists, and we have so much opening now going on in the pediatric radiology as both as a fellowship and as attending as well. So you will get a chance to meet or connect with the people. There is a resident and the fellow session as well in those conferences, so you can just go there, talk to the US resident or the fellow. All the program director love to go to those meetings because they are looking for a fellow, so you can just talk to them. And then, I mean, yeah, once you get into the US program, I mean, it's a very straightforward pathway. You just need to get into the US. I mean, if you are interested, you just need just one that fellowship when you enter into the US. And then it's a very straightforward pathway. I mean, you can just complete either one more fellowship, and then they will hire you as a faculty or attending. So the only thing is, I mean, just the prerequisite for going into the US, all those MLEs and getting one opportunity or maybe getting a fellowship for you.
Right. So, Dr. Zika, the same question. Any final comments or any final message you would like to give to our younger audience today? Your mic is muted, Dr. Zika.
I would say just work hard, and while you're training, get the maximum out of your training and collect evidence as you're going along, because it sometimes becomes very difficult to collect evidence retrospectively, especially having your number of reportings and different workplace-based assessments like procedural skills and reporting reviews. So all of that kind of really helps keep record of your MDT assessments, apply for different conferences, present posters, do the required audits. All of that paperwork helps to build up your portfolio and have like a good CV. That's definitely going to help you be projected in the right direction and keep up to date with the guidance that's available online. So I've shared all of the links that I used for my presentation, and I've shared them with the moderator. They can share them with you and also pasted them in the chat box so you can review those websites in your own time, because there's a lot of guidance available on that. And all the best.
Okay, thank you so much. So finally, this brings us to conclude our sessions. We had a very successful run of 5 webinar sessions, particularly oriented towards pediatric radiology. And I believe this particular session was quite helpful for all of our audience, particularly for me. I and Dr. Meena, we are truly humbled and honored to be able to moderate these 5 sessions for you guys. So, and I hope this was quite informative for you.
If I may add a little here.
Yes, ma'am, please.
Everyone.
Yes,
Sorry,
they were about to invite you actually.
Okay, I thought he is going to end here.
No. Assalamu alaikum. So I think let me introduce. Assalamu alaikum, everyone. Let me introduce Dr. Shaista. You all know her. She's our vice chair for academics for Aachen University Hospital, and she is our residency program director as well. And she is the co-director of the breast imaging, women imaging fellowship program at Aachen University Hospital. So that will be great. I particularly asked Dr. Shaista to. I invited her just to announce or just give you the heads up about a good news. So, Dr. Shaista, stage is yours.
Thank you very much, Kiran, and congratulations on your excellent course which you and your team conducted. You, Kumail, Meena, Shahryar, and of course Asim. So well done, team. And then thank you to the presenters of today's session. Excellent presentations, and I really thoroughly enjoyed their guidance and what they told every one of you, because I believe previously these guidance, this type of guidance was not available. So, and I think it's going to be very helpful to our new generation. So now the good news is we at AKU will soon be announcing, like in April or May, our pediatric fellowship, first in Pakistan. So all of you, all of the participants, keep an eye on it and do apply. It's going to be a very competitive position. So prepare for it and apply for the fellowship. Good luck to all of you. And thank you, Salman and Azika. And of course, Kiran. Thank you, Allah Hafiz.
Thank you so much, Dr. Shaista.
Thank you,
Salman. Thank you, Azika. See you.
Thank you, Salman. Thank you. This will surely help many rising stars who will, inshallah, guide the next generation in your places in future. And I think we should. I believe the Azika poll should be again. We should relaunch the poll. What do you think, Sharia? Let's see what is the shift of audience mind after the talk of Salman. It was just for the Azika first. So I think we can see what is the shift of the audience. You can run the relaunch the poll. What do you think?
Yes, sure, ma'am.
Yeah.
Let's see if there's any change in response.
Probably their opinion has been changed. I'm just wondering.
Yeah, I personally feel like when even here in the UK, a lot of people are just scared of pediatrics, and I don't know why. I enjoy it. But
They think it's a no-go area. Yeah, exactly. I know.
Everybody's just scared of it. You see a pediatric X-ray, and everybody's like, sorry for that. That's not
and think about the MRI brain of the neonate. It happens with all of us. So now, Azika, now see the results now.
Yes,
I would like to show the results.
Yes,
definitely amazing.
Yeah, I'm so. Thank you, Dr. Mudassir, for always sending us the good remarks. Dr. Mudassir is our constant attendee, and he was always sending us the very encouraging remarks about all. Thank you, Dr. Mudassir. I really appreciate. So now there is definitely a shift.
Yes, definitely.
Salman, well done. Job done. You did a great job. So thank you very much.
No, thank you so much. I mean, since now we have a pediatric radiology, I mean, it's going to be in AQ. I would strongly encourage, people to apply for this.
Yeah.
This will just open. I know how the pediatric radiology back in Pakistan. Other than AQ, I think everybody is reading pediatric radiology. So, it's just, it will help the management, the child care and everything. It will just promote those. So it's so good. And then, once you're done with AQ pediatric radiology fellowship, I promise, it's going to help you if you want to go to UK or US. I can put my email address on the chat. And once you're done from there, maybe you don't need to do a fellowship here in US. You can just get a job, because the AQ radiology, particularly pediatric, I work there, so I know for sure. It's much better than where I did my fellowship. I did my fellowship where Dr. Adil Siddiqui is the one who did the neuroradiology talk on the first one. I did my fellowship there. But I promise, the AQ pediatric radiology fellowship will be much better than where I did my fellowship, because I'm just doing body imaging. In AQ, you guys will get neuro as well. Everything. There's going to be so much. We are here like 6 or 7 fellows. So I don't know whether it's going to be 1 fellow, Dr. Kiran, or 2 fellows per year.
So it's going to be the 2. Unfortunately, we were trying to make it the 1 year, but it has to be the 2 years program, because we are going to apply for the CPSP recognition of this program as well. It's a 2 years program. In the first phase, we will take the 1, and probably we'll try to have the 2 at a time, but time will tell us how it will work. So it's PG and lots of things are involved. So good thing for everybody, as Salman said, for the SPR. SPR is the Society of Pediatric Radiology. For good news for this time is that Pakistan is also contributing there, and Pakistan representation is going to be there. And Pakistan was selected as an invited presentation for the best presentation in the Asian Oceania Society of Pakistan, Asian Oceania Society of Radiology, Pediatric Radiology. So Pakistan is going to represent this time the Asian Oceania Society of Pediatric Radiology in SPR. Though hopefully, if any of you are planning to America this year in April in Hawaii, Honolulu, so you all are welcome to join us.
It's amazing. I mean,
probably you're going to see many of us there.
It's so good. I mean, it's so good.
It's lovely. And I'm inshallah, that's the way I look forward is probably you will see all these are virtual, brilliant speakers in person in Pakistan soon for a big conference, inshallah. Thank you very much. So before I end this, may I request Mina or Sharia, do you have the poster of our workshop ready to announce?
Yes, we do. Mina, can you please share that?
So everybody, so this is the part of this course, the hands-on training on the pediatric neonatal